August is National Breastfeeding Month. Breastfeeding is the best source of nutrition for most babies. We here at Cherokee Indian Hospital Authority are here to show support, provide resources, and answer any questions you may have. Let's go talk to some of our awesome staff to have them answer some questions and give some tips and facts about the breastfeeding journey. What are some of the benefits to breastfeeding?
So breastfeeding is good for you as well as for the baby. For babies, it's been shown to help decreases the chance for infection and illness, as well as very nutritious for the baby. It even it changes for the needs of the baby as the baby grows. It also decreases the chances of obesity, asthma, sudden infant death syndrome, as well as type 1 diabetes. It's great for the baby's immune system, and it also is much easier to digest compared to formula.
For mom, some of these benefits for breastfeeding can be amazing. We know that breastfeeding moms can help recover the postpartum uterus quicker. We also know that it helps reduce the risk of ovarian and breast cancers. It can also reduce your risk of hypertension, which is high blood pressure, and your risk of getting diabetes. The benefits also for breastfeeding for mom is that skin-to-skin contact and that bond that forms between mom and baby. It can be so beneficial for baby as well because we see that skin-to-skin bond can help regulate blood sugars, regulate heart rates, reduce the blood pressures, and then also at the same time, for those who know in the newborn, those sleep-wake cycles can be a real doozy. And that skin-to-skin contact and breastfeeding can help regulate those sleep-wake cycles.
Is it true that you have to follow a strict diet to breastfeed?
Actually, I'm glad you said that because it's not. A lot of people think they have to follow a very balanced diet so that the baby doesn't lose any nutrients or the breast milk is good for them. But actually, mom's body knows where to get the nutrients from her body to produce beautiful milk for the baby. So what's the situation with mom? Her body may actually be taking nutrients from her body, but as she weans the baby, her body absorbs nutrients even better. I'm not saying you shouldn't eat a healthy diet. I'm just saying that if you eat some things that you think might not be the most nutritious, it doesn't harm your baby.
What are some tips for moms starting to breastfeed?
One of the most important things to know is that you need to begin breastfeeding your baby right after they're born. And then babies are going to eat at least 10 to 12 times per day, which comes out to about every 1 to 3 hours. For the first 6 months, you don't feed your baby any solid foods. And it's recommended that you give your baby breast milk for at least the first 12 months. And it can be a difficult journey, but there are a lot of resources out there to help, and all you have to do is ask.
What resources are available?
Well, a lot of times moms do need some support after the baby's born. So if a mom is in WIC, they have IBCLCs and peer support people that can help them. Wherever they deliver, there may be a support group, as well as there are private practice lactation consultants out in the community. But I also want you to know that here at Cherokee Indian Hospital Authority in primary care, we have lactation support as well. So August is National Breastfeeding Month, and I just wanted you to know that we need to share our stories, learn more about breastfeeding, and remember, milk is medicine.
Milk is medicine.
Milk is medicine.
Milk is medicine.